Vaginal yeast infection, also known as vaginal candidiasis, is a common condition affecting women. It occurs when there is an overgrowth of the fungus Candida in the vagina. While Candida is normally present in small amounts in the vaginal region, an imbalance can lead to an infection, causing discomfort and other symptoms. The classic symptoms of vaginal yeast infection include persistent itching and irritation, both internally and externally, prompting a frequent urge to scratch. A hallmark sign is a change in vaginal discharge that is thick, white, and resembling cottage cheese, often accompanied by a distinct yeasty odor. Women may experience a burning sensation, especially during urination or sexual intercourse, contributing to overall genital discomfort. In response to the infection, the vulvar and vaginal tissues may become red and swollen, intensifying itching and discomfort. Vaginal yeast infections may cause soreness and pain in the genital area, varying in intensity and worsening with movement or pressure. The infection may lead to a rash or redness on the skin around the vagina, accompanied by a warm sensation in the affected area. Pain or stinging during urination is a common symptom, particularly if the infection extends to the urethra. Sexual activity can exacerbate symptoms, causing discomfort and pain due to increased sensitivity and irritation. The entrance to the vagina, the introitus, may become inflamed, adding to the overall discomfort experienced during a yeast infection. While yeast is a naturally occurring microorganism in the vagina, various factors can disrupt the delicate balance of microorganisms, leading to an overgrowth and the subsequent development of a yeast infection. An overgrowth of Candida albicans in the vagina occurs when the natural balance of microorganisms is disrupted, often due to factors like antibiotic use or hormonal changes. Antibiotics, while treating bacterial infections, can eliminate beneficial bacteria in the vagina, creating an environment conducive to yeast overgrowth. Fluctuations in hormones during pregnancy, menstruation, or oral contraceptive use can alter the vaginal environment, promoting conditions favorable for yeast overgrowth. Conditions like HIV and AIDS or immunosuppressive medications can compromise the immune system, reducing the body's ability to control Candida albicans growth. Uncontrolled diabetes with elevated glucose levels creates an ideal environment for yeast to thrive, increasing the risk of infections. Wearing tight or non-breathable clothing, especially synthetic underwear, can create a warm, moist environment, promoting yeast growth. Inadequate hygiene practices, such as delayed changing of wet clothing or use of harsh soaps, can disrupt the natural balance in the vaginal area, contributing to yeast overgrowth. While not a direct cause, frequent or intense sexual activity can sometimes lead to irritation and microtears in vaginal tissues, creating conditions conducive to yeast infection. A diet rich in sugar and refined carbohydrates elevates blood sugar levels, providing fuel for yeast growth and increasing the risk of recurrent infections. Diagnosing a vaginal yeast infection involves a combination of clinical evaluation, medical history, and sometimes laboratory tests. The healthcare provider collects a detailed medical history, focusing on symptoms, previous yeast infections, and relevant health information. A pelvic exam visually assesses the vaginal and vulvar areas for signs like redness, swelling, and unusual discharge. A vaginal pH test during the exam checks for acidity levels. Elevated pH that is above 4.5 may suggest a yeast infection by disrupting the normal acidic environment. A sample of vaginal discharge is examined under a microscope to detect the presence of yeast cells, confirming a yeast infection. In some cases, a culture test is done to identify the specific strain of yeast causing the infection, providing additional confirmation. Lab tests, like a fungal culture or DNA test, may be used to identify the yeast strain. These tests are more applicable in severe, recurrent, or atypical cases. Tests are conducted to exclude other potential causes, such as bacterial vaginosis, sexually transmitted infection, or other gynecological issues, ensuring an accurate diagnosis. The treatment of a vaginal yeast infection typically involves antifungal medications aimed at eliminating the overgrowth of Candida albicans, the fungus responsible for the infection. Common and accessible. Over-the-counter antifungal creams, suppositories, or tablets with clotrimazole, miconazole, or tiaconazole are applied internally or externally for relief within days. In severe or over-the-counter treatment-resistant cases, healthcare providers may prescribe stronger antifungal medications like fluconazole, taken as a single or multiple doses. Short-term use of low-potency topical steroid creams may be recommended for inflammation and itching, typically in conjunction with antifungal treatment. While not a substitute for medical care, home remedies like yogurt or coconut oil application, along with avoiding irritants and wearing breathable cotton underwear, may provide some relief. Advisable to avoid harsh soaps, scented products, and tight synthetic clothing that can exacerbate symptoms and hinder the healing process. Effective management of underlying factors, such as controlling diabetes, adopting a low-sugar diet, and minimizing unnecessary antibiotic use, helps prevent recurrent infections. In recurrent cases, healthcare providers may suggest treating sexual partners to prevent reinfection, but it's not standard for uncomplicated cases. In certain circumstances, complications may arise, particularly if the infection is left untreated or if there are underlying health conditions. Yeast infections may recur due to incomplete treatment, resistant strains, or underlying health issues. Spread of the infection to the vulva can cause increased redness, swelling, and discomfort. Infections lasting despite treatment, linked to factors like antibiotic resistance or immune disorders. Pregnant individuals face an increased risk of preterm birth and low birth weight with untreated or recurrent infections. Yeast infections can be transmitted between partners, emphasizing the need for simultaneous treatment. Incorrect diagnosis or delayed treatment can lead to prolonged discomfort and increased risk of complications. Scratching due to discomfort can result in skin tears, making individuals susceptible to secondary bacterial infections. Chronic infections can significantly affect quality of life, causing persistent discomfort and impacting relationships. If you found this video informative, please consider liking and subscribing for more health-related content. Thank you for watching. Until next time.